Welcome to Health Matters, brought to you by the Office of Correctional Medicine at Southern Illinois University School of Medicine. In this video, I'm going to discuss hypoglycemia, what causes it, how to assess it, and how to treat, evaluate, and prevent it through nursing care and patient education. This video is intended for educational purposes only and is designed for healthcare professionals. It does not replace clinical judgment, institutional protocols, or professional medical advice. Always follow your facility's guidelines and consult appropriate experts when making patient care decisions. The creators assume no responsibility for how this information is used in practice. According to the American Diabetes Association, hypoglycemia occurs when blood glucose levels drop below 70 milligrams per deciliter. While it's most common in people diagnosed with diabetes, it can occur in non-diabetic patients as well. There are 3 levels of hypoglycemia related to diabetes. The lowest level is categorized as mild and will present as a blood glucose reading below 70 milligrams per deciliter. The patient may experience hunger, nervousness, shaking, or sweating. The mid-level is categorized as moderate and will present as a blood glucose reading below 55 milligrams per deciliter. The patient may experience dizziness, confusion, sleepiness, difficulty speaking, weakness, or anxiety. The highest level is categorized as severe and will present as a blood glucose reading below 35 to 40 milligrams per deciliter. The patient may experience seizures, loss of consciousness, or a coma. Though non-diabetic hypoglycemia is rare, it's important to recognize the 2 types because treatment will depend on which type and may include dietary changes, medication adjustments, or possible surgery. The first type is reactive hypoglycemia, which may occur after meals and may be linked to prediabetes, stomach surgery, or enzyme deficiencies. The second type is fasting hypoglycemia, which often occurs between meals or overnight. It may be caused by certain medication, alcohol abuse, serious illness, or hormone deficiencies, and in rare cases can be caused by a tumor such as insulinoma, which is a pancreatic neoplasm that can secrete excessive insulin, or another type that secretes insulin-like growth factor 2, or IGF-2, which activates insulin receptors and subsequently lowers blood glucose levels. Once hypoglycemia is confirmed, treatment depends on the patient's level of consciousness and glucose reading. If conscious, provide fast-acting carbohydrates. Many agencies adhere to the 15-15 rule, which is to provide 15 grams of carbohydrates and recheck the blood glucose after 15 minutes. Some fast-acting carbohydrates include glucose tablets, 4 to 5 grams per tablet, glucose gel, 15 grams per tube, half a cup of juice or regular soda, 1 tablespoon of sugar, honey, or corn syrup, and hard candies or jelly beans. Check the label to make sure there's 15 grams per serving. Be sure to avoid foods high in fat or protein, like chocolate or peanut butter, as they slow absorption. If unconscious, start an intravenous line and administer dextrose 50% or D50 while waiting for emergency medical services. If IV access isn't available, a rapid injection of dextrose may be administered. The recommended dose is 10 to 25 grams or 20 to 50 milliliters, delivered over 1 to 3 minutes. In cases where the patient is unable to tolerate IV fluids, glucagon, a hormone that stimulates the liver to release stored glucose, can be administered intramuscularly or via nasal spray. It is important to recommend a follow-up appointment with a healthcare provider or endocrinologist to investigate underlying causes or medication adjustments. After treating the patient, be sure to document the hypoglycemia incident thoroughly. Accurate charting safeguards legal integrity while facilitating seamless, high-quality transitions of care. Aspects to always document include patient symptoms, blood glucose readings every 15 minutes until the patient stabilizes, extra dosage and route of any treatments given, reassessments and outcomes, and provider notifications. Every nurse interaction is an opportunity for education. Nurses play a key role in preventing hypoglycemia through reinforcing medication adherence, reviewing blood glucose targets, teaching signs and symptoms of highs and lows of blood glucose monitoring, and providing nutrition information and physical activity guidance. To recap, the nurse's role with regard to hypoglycemia includes recognizing symptoms quickly, confirming with a glucose test, treating promptly, documenting every action taken, and ensuring proper follow-up care. Thank you for watching this video on hypoglycemia. The Office of Correctional Medicine at Southern Illinois University School of Medicine invites you to look for more educational content in our Health Matters series.